We are now recording. Okay, you want me to give it a few minutes, wait to see if anybody else shows up, or oh, more people coming on. Okay.
I'm not sure if Amanda might be coming as well.
Let me check in with her. Just give me a second.
And Stacy, right?
I'm not sure about Amanda. Maybe we can get started since we are gonna be recording it anyways.
Let's go ahead and get going then, and if we need to repeat anything, we can. So, three-dimensional planning is typically the kind of the last training that we do because it talks about kind of connecting things together within the dashboard. So let's go through that kind of quickly, and then we'll go back into your strategic plan and talk about any questions that you might have on how to continue to implement the plan and then potentially implementing your chip plan in the system here. So let's go ahead and move forward here. First of all, you recall the planning model here. Just kind of review that. The organization is your health department. Groups is the structure of your health department, plus the primary plans are typically individual groups. So you saw your strategic plan as an individual group within itself. Each group has its own set of services or initiatives. Again, services being the things that you're doing on a regular basis, initiatives being future things that you're trying to implement. Each service or initiative has its own set of high-level goals. Each high-level goal has its own set of objectives. Each objective has its own set of activities. Now, you recall when we were doing the training, we talked about using the example of tobacco cessation. So we're going to kind of use that in the background a little bit as we're doing this today. So the group is Tobacco 2024. Tobacco cessation is the initiative. One of the goals was to reduce smoking in high schools. One of the SMART objectives was to reduce smoking at Wayne High School by 25% by the end of the school year. And then the activities were to create training curriculum, provide 9 training sessions a month, and contact the local tobacco vendors. So we're going to kind of use this as an example as we go through here. So first of all, three-dimensional planning. What is three-dimensional planning? We'll go over that in kind of detail here. Three-dimensional planning is all about categorization of plan elements in there. So you got categories and subcategories. We'll talk about how you manage those. It's a pretty simple process. Then how do we assign the categories and subcategories? There's on the dashboard screen itself, you may recall at the bottom, there was a button down there called priorities. And what that is utilizing three-dimensional planning to map the strategic priorities from your strategic plan against everything else in the system here. And then there's a bunch of different reports in there. We'll talk about 3 of them actually. Categories report. So how are each plan element, how are the categories assigned to specific plan elements? Category tag report's the big one. That's how you gather the information out of the system based on a specific set of categories that you've assigned. And then the categorization report is looking at a specific plan. How is it categorized? Usually kind of meant to go back after a period of time and say, whoa, what all categories did I assign to this? So what is three-dimensional planning? So if we take an example of the Fab 6-pack of plans that are in here, and we want to look across these plans, for example, what are we doing across the entire department? And by the way, it's not by any means limited to these plans. It can be any plans you have in the system. But what are we doing for Public Health Essential number 1 across the entire department? So what we're going to do is go in and categorize, and I'll show you how that happens here. We're going to categorize specific plan elements out of various plans against Public Health Essential number 1. Then we can go back and extract that information by say, show me a report of everything across the whole department that is related to Public Health Essential number 1. All of the FAB standards are in there, and I just updated your plan because you've had the system for a while. I updated it to the FAB 2022 standards and domains and standards in there. So in this particular case, you can say, okay, I want to see everything in the department, every document, every plan element related to FAB standard 6.1. And where this comes in handy is when you're going through your FAB site review, is you can actually bring that up on the screen and you can show every piece of every plan plus every document related to, in this case, standard 6.1. The strategic priorities from your strategic plan getting mapped against everything else in the system again. So we're saying these are the plan elements related to partnering anywhere in the system. So you can imagine CHIP is going to have a bunch of plan elements related to partnering in there. And that's what's going to create the bottom of that dashboard screen. And then documents. You can tag documents as well with all the different standards and measures and all the different categories and subcategories. So you can just go back in and say, in this case, show me every document that we're going to submit for standard 4.2. So instead of having to search through a bunch of stuff, it's all in one place for you here. So the first thing, managing the categories and subcategories here. So let's go live into your account here. Okay.
And Fred, just to clarify, Hamachi will be the one assigning people different categories based on fab domains or based on the plans they're working on. So
Okay.
Is that the same level of approval that they will need to be able to tag things?
No, anybody can tag things, but to manage the categories and subcategories, you need to be an org admin.
Okay, sounds good. So anybody can tag something. Perfect.
Yeah, anybody can tag them. I'll show you how that happens. Okay, so you're going to go up to the main menu, the gray one up here in the top right. Click on that, and you're going to go down here to categories, manage categories and subcategories. So when I click on that, on the left side is going to show you, and there's a bunch of stuff in there that you may never use that you can get rid of real easily if you want to. But for instance, your strategic priorities, these happen to be the ones from the demo organization. What you're going to be able to do is go in there now that your strategic plan is in there, is grab the strategic priorities. Typically what I'll do is generate a report first at the service initiative level, which are your strategic priorities. Generate the report, have it kind of by the side here so you can copy and paste. So you're going to basically go in here and replace these 5 strategic priorities with your strategic priorities from your plan. And if you want to just send them to me, I'll be happy to do that for you as well. It's a simple process. You're going to select up here, you're going to go down here and highlight that and type in your new one or copy and paste your new one in and save it. That's all there is to it. If you get down and there's more strategic priorities than these 5, or you want to delete one, if you want to delete 5, you just hit the red X and delete it. If you want to add one, you can hit the plus. It'll open up this field, type in a new one and save it in here. On the left side, you got a bunch of different things. You see service type over here. So direct service, indirect service, policy approaches. And these are, kind of public health standard things in there. Requirements. Why are we doing this? Federal law or statute, grant deliverables, whatever. So we'll get down here to the essentials of public health. So these are the current 10 essentials of public health. You can tag these against anything. So we'll go through an example here in a few minutes with the tobacco program. You got the CDC domains, a lot of different stuff. And like I say, if you're not going to use any of these, you can just delete these out of here. But down here at the bottom is where we have the fab domains. So for instance, we have, I think I just said domain 4 was going to kind of match up here. So we have domain 4, standard 4.1, engage with the public health system and community in promoting health through collaborative processes in here. So these are the fab domains and standards in here that you can tag. Oops. Like I say, I just updated them here. So poof, that's all there is to it. Yeah, it's just basically text in here that you're working. Okay, so to manage them, again, you can add a new category down here. The category number here determines how they sort. These are unfortunately, 1, 2, 3, 4. So you're going to have to move things around if you want to put them up higher. But if you're going to go in and look at these things and say, hey, I don't need a lot of these, you can delete them. That'll leave you kind of empty spaces in here if you want to be able to move certain things up. So you'll see down here, we have 15 through 24 down here as the fab domains. And then again, you can move these anywhere. So you're going to add a new one. It's going to add it to the bottom. And then you can move it up by moving the category number around here. Once you add a category, then you're going to go over here and add the subcategories for that category in here. Like I say, most of these are in here that you'll be using, but you can add whatever you want. A lot of people have state requirements that they have to meet. So what they're going to be able to do is add a category of state requirements and then the subcategory of those requirements. And then you can tag that against your other plans to see where do you meet those state requirements. And when it's time to generate a report to give to the state, you can generate it right off of the category tag report here. So that's really very simple. If you're an org admin, you'll have the ability to come in here and manage these. Any questions on managing the categories and subcategories? We haven't got into how to use them yet. We're just talking about how to actually get in here and create new ones and edit them and whatever. Pretty simple. Okay, let's go down to the next level here. We'll skip over questions since okay, so how do we assign those categories and subcategories? Let's go back to here. I'm going to go back to our groups, and I'm going to go down to our Tobacco 2024 group. So when I get down to the service initiative level here, anything that and below, so I've got, let's say, tobacco cessation 2, and our goals, our objectives, our activities. You may have noticed that this little button appears on all of those screens here. This is the categorization. It's a little up arrow with a paper clip on it. So when I click on that, I'm going to say, okay, I want to categorize tobacco cessation, the initiative, against, let's say, the essentials of public health, and I want to pick number 4. I think might fit, maybe not, I don't know. And I want to be able to categorize it against Fab Domain 4, Standard 4.1. So now you can see I have both the essentials, and I can pick as many of these as I want, as many subcategories as I want. And then I'll go ahead and save that. Now, because I'm up at a high level in the pyramid, it's asking me, do you also want to categorize all of the sub elements? So in this case, the related goals, objectives, and activities. Let's go ahead and say yes. So now when we go back to here, you'll notice the little blue eye on here indicating that it has been categorized. And if I go down the pyramid here, you'll see that everything below it has been categorized. Now, sometimes you're going to have sub elements that don't quite meet the standard that you're looking for. So you can go in and take those out. So let's say one of these goals, like smoking in public areas, didn't meet those standards. I could go in here and remove the categorization from there. So a lot of times you'll start at the highest level, take it all the way down the pyramid, and then go in and just tweak it, because just typically there's going to be, if any, there's going to be just a few of them that don't quite meet the categories in there. So that's really all there is to assigning it, is that little button right there on any of the screens. This button also appears on the document management screen as well, so you can categorize the documents against those standards as well. Let me see here. I think that was, yeah. Yep. Okay, so we talked about that. Pretty simple.
I think so. I want to just, can you talk a little bit about when staff are entering in their required documentation in the FAB domains, which is a little bit different. It's like entering in plans, but would a process or a standard be to tag things as you're also entering in things, or do you recommend like one person be responsible for tagging and reviewing things?
That's a really good question. You can kind of do it either way. You can always go back and tag them. But if you wanted to set up a process like a standard operating procedure that says, when you put in this document, you're putting it into one of the objectives or the measures typically. So you can go in and say, this document meets this measure. So you kind of have it almost duplicated in that because you're in the accreditation plan and you're also tagging it with the categories and subcategories. So yeah, I don't really say that I have a hard answer on that one. It can be either way. If you got one person who's very comfortable with the tagging process, then maybe you let everybody else put the documents in, and then you just go back and tag them after the fact.
Okay. And then some of those categories can be removed too. For example, if they don't use anything against like CDC's winnable battles, that can just be totally removed.
Yeah.
Okay.
Yeah. In fact, again, it takes an org admin to be able to do that. But I can go down to here and so is there a particular one like, where was it? CDC winnable battles? Yes or no? You want to get rid of that one?
Oh, I don't know. I was just using that as an example.
I would just delete one and show you how to do it, but that's easy.
Okay. I mean, I think that's fine if you want to delete one and show, but I think that makes sense.
And you can put it right back in as well. So it's just simple. Okay. But when you delete a category, it also deletes the subcategories, obviously. So I'll just click that and say, okay, and now it's gone. So now,
okay.
And you can do that with any of these. So
same thing for healthy people. Like most agencies now are probably going to start, especially in performance management, start to use those national benchmarks of Healthy People 2030.
Yeah. These
so are those in there already, or would that be something
It's something
Um,
you'd add at this point. So because you
Okay.
guys have been around for quite a while, these are the older versions, from 1.0, 1.5 fab kind of stuff. So yeah, anything, and you can just edit these, if you want to be healthy people and say 2024 or whatever the latest is, then you can put that in there if you want to. So again, it's just basically text. And then under here, you have subcategories which are attached to the category, but there's nothing magic about it other than the numbers to organize them in numerical order over here. Okay, let's go back to here. So we talked about the categorization against the strategic plan. So when we get your strategic priorities in there under the top level,
They should be in there.
well, okay, yeah, they're in there, but they're not in the categories yet here.
I see. Okay.
Yeah. So what we need to be able to do, again, what I would typically do is I'll go to your strategic plan and I'll generate a report, operational plan report. No, I don't want to do hidden things. And then I'll take the report down to just the services level. So yeah, these are your 5 strategic priorities. So we can go put those in there, just copy them out of here, go back over to, or if you save this report, then you can open it up in another browser tab or browser window, and then you don't have to go back and forth. So yeah, these are your 5. So go ahead and put those in there, and then you're going to go in and use those as the category and subcategory for anything else that you want to map against those. Okay. And again, like I say, it takes just a few minutes here. Just save this to another file, open it up in the browser, and then you could just go back and forth and copy them. Okay, so what's going to happen when you guys do that, and if you do go through and attach those categories to other plans in the system or other places in the system, those strategic priorities are going to show up down here, and then it's going to have all this information over here about, do you have lagging activities? How far ahead of or behind schedule are you? Anything overdue? Number of red, yellow, green, and gold. And that's just this priorities button on the dashboard here. And we went through the dashboard stuff already. Okay, get rid of that. So there's 3 different reports that we use in 3-dimensional planning here. So let's go back to our tobacco group here. I'm going to go up and to the reports menu. And the first thing I'm going to look is our categories. So that list that you saw on the categorization screen to develop the categories comes out in a report here. That's all it is. So you've got the all the different ones in here. So here's the the essentials of public health, and then down here are the fab domains and standards down here. So everything is just in this report, and that's all it is, just a report. So you can go back and kind of review and not have to click through each one. So you can go in here and say, yeah, we don't need to have the happy grant in here anymore. So we'll go back in and delete that. So that's report number 1. That's kind of the simplest one. Report number 2 is the category tag report. So we know we categorized, let's say I want to go back to our tobacco plan here, start there. And we said, okay, strategic priority. No, we didn't. We did essentials of public health number 4, and we did standard 4.1. Up here, I'm going to say, what level do I want to look at? And you can see the documents, abstracts we haven't talked about, services, goals, objectives, and activities. So I can go ahead and say, we tagged the services here. So I want to say, I want to see every service that has essential public health number, or essential public health number 4 and standard 4.1. And I'll hit this button here, and we don't want anything that's hidden, and it'll take it a few seconds to generate that. And there we go. So the only thing we've tagged in there is tobacco cessation number 2. And it's showing up here. What did we actually look for? So the categories and subcategories selected: essentials of public health number 4 and standard 4.1. So this is the report to get now. There's some more cool things about this report. If you guys are familiar with Boolean logic, basically you got ands and ors. So if I'm at the essentials of public health, and I want to see everything that has either 4 or 6 or 8. So any one of those in there, and I'll go ahead and deselect this one for now so it doesn't get too confusing. So within a category, it's an OR function, meaning that if the plan element is tagged with either 4 or 6 or 8 or any 2 or all 3 of them, it's going to show up in the report. So, but within a category, it's an OR function. Across categories, it's an AND function. So if I go in here and also select 4.1, what it's saying is that in order for it to appear on the report, it has to have, let's make it easy to start with. It has to have essential public health number 4 and fab domain or fab standard 4.1 attached to it here. If either one of those is missing, it will not show up on a report. So it's got to be both of them. So you can do a lot of kind of magic manipulation with this stuff after you get the things all tagged against the different categories and subcategories in here. Now, if I go down here and say, okay, I have standard 4.1, and again, I go to 4, 6, and 8. What this means is if it has either 4 or 6 or 8 or any 2 or any 3 of these, and it has fab domain or standard 4.1, it's going to show up on the report. So you can play with that and you can get a lot of different variations of that. So you can say, it appears on our strategic plan against a specific essential public health, but not on our CHIP or something along that line. I know that's kind of a complex way to look at it, but are there any questions on how to actually generate the category tag report?
It sounds like the category tag report too could be used for identifying things that maybe you don't actually have tagged and you should. So if it's not showing up on a report, then, maybe like the CHIP, the stuff Emily's working on with health literacy, like there might be other things that it could fall under a fab domain and we just haven't tagged it yet. So you could use that report to see if it's tagged, right?
That's one way. The other way is you're a good lead-in person, and that's the categorization report. So what it's going to show me is how everything is categorized. So down here, you can see that tobacco cessation is, we got the tactics one. Okay. So basically what we're saying is tobacco cessation is categorized down here with category 5, essentials of public health, subcategory 4, category 18, fab 2022 domain 4, standard 4.1. Now, if you had a whole bunch of these plan elements, you can scroll down and say, oops, I added a new plan element. I forgot to categorize it. So this is the report. I think, Kelly, what you were talking about is to find things that have not been categorized or how everything has been categorized. So it really does make it kind of easy to go through it that way. And yeah, so that's the last report that I wanted to talk about today. So that is really all there is to three-dimensional planning. And you can go in there, by the way, you can tag everything, and then you can go right back in there to that. If I went back into that same, let's do it just for kicks here. I'll go back into my service initiative level, category 2. I'm just going to go in here and untag everything that I did. So I'll undo that, and I'll go down here and undo that, and then I'll save it. It's going to ask me, do I want to go all the way down to pyramid? I'll say yes. And now when we go back, you notice the blue eye is gone. So I've basically uncategorized everything. So you can go in and make those modifications. So once you get it categorized, it's going to show you what's in there. You can leave those in there and add more. It can remove those. Lots of different ways to do that.
And just to clarify for everybody on the call, when the time that this is most useful for is when FAB is actually there doing a site visit, or when you're actually trying to find metrics for like an annual or a quarterly report. This isn't something that you're going to use all the time, like monitoring activities. This is more to demonstrate how all of the different activities across all the work that's being done within the health department, like interplay with each other.
Exactly.
I don't know if that makes sense.
Exactly. Okay. Well, that's all I had to do on three-dimensional planning, and it was 20 minutes or 25 minutes, so not bad. Now, let's go back into your strategic plan, and why don't you guys kind of walk me through what you'd like to see here?
Patricia, I don't know if you're able to share or anything that you put in there. In Hamachi, I know we talked a little bit about this. If you want to be able to, I mean, everything should be in there, Fred, what we talked about on our last call.
Yeah, it looks like the objective leads and activity leads haven't been assigned yet.
Correct.
Is that one of the things you wanted to talk about?
Well, I think, Hamachi can do that, but you can definitely go through it now too if you'd like.
Okay, I mean, it's super simple. You're going to go down to first of all, at the objective level, you can hit the drop down. So this is implement community satisfaction survey. And it's blank because there's nobody assigned by default to the strategic plan group. So I hit this guy. Now, does anybody know right offhand who the person is for this particular objective?
I think it's Stacy and Diane, if I remember this correctly.
Well, you can have one person as the objective lead. So is it Diane Bautista? And you can change it. I mean, let's just pick that for now.
Mm-hmm.
Pick Diane, save it, and then you got to save it here. So Diane is now our objective lead in here. And then to save it or to change it, same thing. Hit the drop down, pick a new name, save it here, and you're all set to go. Now, when you get down to the activity level, it's down here. So you've got the activity leader and team members. We'll click on that. Again, we're with, I don't know why it shows that group here. We're going to open that up. Okay, so you're going to first pick typically the team lead. Let's just kind of randomly pick a few people here. So I'm going to pick Amanda as our team lead. And when I click the lead button, it automatically makes them a team member. And they're the person who's by default going to get the email notification, the real-time planning email. And then you're going to pick a couple of team members. Let's pick Aaron and Himashi. So now we have one team lead. And as you can see, 3 team members. I'll go ahead and save that. And then they show up down here. The L is lead, the T is team member, and the blue around the L is email notification.
And Fred, what they've done so far within the department is they've identified who's in charge or going to be the team lead for each. Under each of the 10 domains, there's some of the domains have 2 or 3 standards, so they have a lead for each standard.
Right.
And so then those standards will be mapped, of course, to the different plans. Strategic plan is going to be in domain 10. The CHIP will be in 5. So, there are some natural leads that we'll be able to go through and assign. But I think to get started part of it is actually how they're going to start putting in documentation for FAB. But this is super helpful for them to see the strategic plan.
Okay, well, we can talk about the documentation. That's real easy here. Let me go ahead and clear these out so we don't accidentally get anybody. Now, on the accreditation plan, again, you're going to get down here and assign people typically at the objective, the measure level, and the activity level here. Now, if you have people, so if you have domain leads assigned already, and I can mass push them all the way down so you don't have to go through 150 activities here. Just give me the names and I'll push them down. Then you can go back in and tweak them. So at the objective level, the objective lead, who's typically the domain lead, might reassign the activities to their team members or something. So let me do the bulk of the work for you by pushing it down, and then you can go in there and kind of manually tweak it just like we did. It's a lot. I think there's 164 activities or something along that line in the plan. So let me do the work for you. Okay, as far as document management here, real simple. Let's pick domain 1, standard 1.1. Objective. Typically, this is where the documents are attached, is at the objective or the measure level here. So it says, we're going to attach a community health assessment dated within 5 years. I'm going to go ahead and attach just a demo plan that I have here. So we're going to click on the document management button here, the blue one. And then I'm going to click here to add a new document. Choose a file. I've got a little test directory. I think I've got a USA Public Health CHA or something in there. I'll just pick a random document here. Oh, here we go. USA Public Health CHA. Okay. Open that up. Now I'm going to say upload. And now it shows up down here as the file name, the size of the file, the current date, And then in here, you can say CHA, you can set the traffic light to whatever you want. You can put any notes in here, just, and then you're going to save it. And that's the document. Now, just FYI, if you add this exact same file name, so let's say we do an update on the CHA, we want to add a new version. If it's exactly the same file name, it's going to create a new version up here. So right now it says version 1. If I add the same one again, pardon me, it's going to be version 2, version 3. By default, it will always show the latest version up here. So if I want to see all the versions, I just click this guy. Now there's only one in there, but it would show all the versions. The other thing that's kind of common while you're doing the document management here is if you're just inputting a draft document, which you can use this to manage all your documents. If you put a draft document in here, you might mark it as yellow. And save that. As you get to the point where the document is completed in the department, so you guys are all ready to submit your CHA, mark that version as green. And then when you actually submit it, flip it over to gold. So what you're saying is a draft is yellow, a finalized document is green, and once it's been submitted up into EFAB, it's marked as gold. There's a lot of things you can do once you do that. The org admins have a document management off the main menu that you can select the accreditation plan and then do the document management for the accreditation plan, and it'll show you every document attached to the plan. So you can scan through the lights, and if you see anything that's not gold, you know that you haven't submitted it yet, or it could even be a draft that you haven't finalized yet. So a lot of things you can do with that. But this is document management. Again, it's real simple. Typically, you're just going to put the description of the document other than the file name in here. Any notes you want to put in here, you can use this button to hit the date and timestamp on there. And that's really all there is. You're going to set the traffic light based on where you stand with the document here. Is that kind of what you want to see as far as document management goes? Now you also notice that the document management button down here says it's got one document attached. It'll show you, however many you've got attached. You can have as many as you want.
Oh, that's very helpful. And Hamachi has set up internal files for the health department for them to start to put all of their documents together. When they start loading documents in that we feel like that are going to probably be used for FAB accreditation, they will put everything in. The traffic light will still remain red, but once they decide which documents they're potentially going to do all the required documentation training from FAB, like loading up the cover sheet,
Right.
putting everything together. At that point, when they're deciding that, I think we talked about it being yellow, so that as reviewers, myself, or if Emily's looking at their chip, things like that, then we will be able to say, yes, this looks great, or no, it doesn't. When it looks like it's ready and complete, we would move it to green so that then the health department knows that it's ready to be uploaded to EFAB.
That makes
And then when that's done, sometime between May and June, they'll mark that as the yellow bar or the gold bar.
Okay, and that makes perfect sense, Kelly. What else can I show you?
Hamachi, do you have any questions or things that the staff that are working within the system wonder about?
I think I just need to practice using the system more often. Seeing this, when you're explaining it, makes sense and looks good. But I think the more I use it and more I practice using, different tabs that you were just showing, I think maybe I'll have more questions then. But as of now, I don't have any additional comments or anything that I was particularly interested about.
Yeah, you're exactly right, Hamachi. When you get in there, it's where the questions come up, like, what's this for? What did I do? How did this happen? Feel free to reach out to me. We can pop open a GoToMeeting anytime and go through it. So whatever you need.
That would be great. Thank you so much, Fred.
Anything else?
Patricia, is there anything else you think with a strategic plan that we should, since that document's in there, that we should talk about today if we have a few more minutes? Or
Yeah, I think the only thing that's new since the last time we talked is Fred, I did build out, like we discussed, there's a new, I think it's initiative around actually monitoring the plan. So, Somerset, it may look like you have 5 strategic priorities now, but what it is we just created another kind
Oh,
of priority around monitoring the plan.
sure.
And
No,
that's
great.
where all of your metrics live. So you don't need to go into each individual priority to input your metrics. It'll all be in one spot.
Oh, very nice. Okay.
And we can also assign responsible owners to those as well. So they'll get the push alerts and know when it's time to upload their metrics.
Yeah, that's a good idea, is getting the people assigned, getting the dates assigned, so that the system, if you got a beginning and ending date and you manage the percent complete on the activities especially, it'll let you know when it's time. It'll let you know that you're on track, you're behind schedule. If you're behind schedule, you're going to get an email the next time they go out saying you're behind schedule. So you can manage that real easily that way. Okay, well, if there's nothing else, I will let you guys get back to the real world here. And if you do need anything, again, feel free to reach out. I can, usually find a way to squeeze in an hour or so to help you out when you're wherever you need it.
And I think too, we will send you that list of for the FAB documentation specifically, where those primary individuals are assigned.
Yes, please.
It's not. Can we send it at the standard level? Because for some standards, for example, standard 1, there might be 2 different people that are leads for 1.1 and a different person for 1.2.
Well, unfortunately, the metric or the objective level or the measure is the first place that you're going to assign people.
That's fine.
Yeah, there's no assignment at the goal level.
Okay, so we will send it to you. We'll pick one person for each of the 10 domains, and align that with. Also send you. Well, I think we can do that internally with the specific plans, because some of that will cross over.
Okay.
Assigning plans, and by then, Hamachi, you'll be a pro at it, and we can help too.
I'm really praying that I come to that level.
The pressure's on now, Hamachi.
No, and Fred and Andrea are very helpful too. So I think once it gets set up and people use the system, it's actually works pretty good. It's just getting used to it, like you said.
Yeah, like any system, it's just getting used to it and getting comfortable with it.
Yeah. And just so everybody else is aware on the phone, Hamachi has some time set up with Fred put us in connections with someone from Clay County in Missouri that has done a lot of this work. So we are developing like some standard operating procedures and some of those things and some tip sheets. Fred, maybe if we have just a minute, do you mind showing them where they can get some of the tip sheets directly in the system too, if they're wondering about entering in something?
Oh, well, a couple things. No matter where you are in the system, so let's say I'm at the service initiative level, have any questions, the blue eye up here is help and information. Lots of stuff in here. The first thing it is where I came from, services initiatives, step-by-step process to enter something or to delete something or to edit something, plus the definition of all the buttons that's on there, more than just a little rollover. It's got a lot of information. That's one thing. The other thing is you've got the entire user guide right here. This blue one is a hyperlink PDF file with everything in it. And the table of contents is hyperlinked. So if you got a PDF file on your desktop, you click on the table of contents and it'll take you to that section. The one that I like to give people is this last one down here. You go to the blue eye, go down to the bottom here. It's called implementation guidelines. On the second page, it starts out how to enter an operational plan. It's using the tobacco cessation example, but it gives you every button click and everything that you need to do to enter the plan. It's about 2 pages worth of stuff, all the way from the top level all the way down, but it gives you everything you need to know. So I would highly recommend reading through that if you get a little confused on what do I do next entering a plan, but it's all in there.
And that's able to be printed if they wanted to have it out until we have, those standard operating procedures and things like that.
Yeah, it's a good starting
step.
Yeah, it is a PDF file. This is also the video here. There's also video training modules on everything. It's just basically the same steps over here, but in a video format if you prefer that. And then the training up here, you got the 5 training modules. Nice, refresher if you haven't been in there a while. The intro, Basics is every button and every screen. Operational plan development is kind of what we're talking about, the step-by-step process to enter an operational plan. Performance monitoring is all the charts and graphs and reports, kind of like what we talked about today. And then for those of you who are org admins, it's about a 30-minute administrator training module on all the different management of permissions and users and all that kind of stuff. So it's all in there.
Yeah, that's helpful. I know you shared that before, but just having the specifics and the example now that people are in the system more, that's helpful.
I do recommend if you get into a question on any screen, click the blue eye first and take a look. It usually will answer your questions. If not, you can look down through some of the other documentation, or you just pick up the phone and call or email me. Okay. Well, thank you so much, everybody, for your time today. If I don't talk to you before Christmas, have a wonderful Christmas holiday.
Happy holidays, Fred. Thank you so much.
Thank you. Bye-bye.
Thank you.
Bye. Thank you.